Welcome back. Doctor, I know that once you get infected, we know incubation period is between 2 to 21 days, but once you get infected, you have about 12, 13 days before you might die. Tell me what happens. I want to understand what happens in the body once you get infected.
Yeah.
And in simple terms.
Well, usually when the virus gets into the body, virus are particles. They are not living. They can stay outside and will become non-living thing. Once they get into the body, they will now integrate themselves within our own cells. So they will take our cells as their own house. And once they take charge of that cell, they will replicate. As they are replicating, they will shed, that cell will burst and it will infect another set of cells. And in such level, such person will have fever because there are some things that we call pyrogens, some chemicals, if I have to put it that way, that will make that person feel feverish. And there is also intense muscle weakness, as well as sore throat. And all these symptoms are things that are generally non-specific.
Okay.
Anybody who has malaria or typhoid or any febrile illness may present with such presentation, okay? But because the virus has a lot of chemicals within it that they are continually destroying the cells, they have this toxicity for the liver and for the kidneys, in which the function of the liver and the kidney will go down. And again, it causes a lot of bleeding disorder. So within a very short period of time, they will have made the liver not to function properly, they will make the kidney not to function properly. The major duty of the liver is to break down all that we eat so that it can distribute it to all our bodies, okay? And if that one is deranged, it will have effect on bleeding, it will have effect on the food we eat, and the maintenance of the normal body function. And the kidney is what washes all the death within our body.
It's not functioning.
And once it's not functioning, the kidney will have accumulation of chemicals that those chemicals will affect the brain. And we have
I guess I can see where all the confusion comes in from. You know, when you have symptoms that are very similar to almost every normal
it
disease
sounds like
that you have
malaria,
out there.
meningitis,
You just think,
typhoid.
oh, I have a headache, I'm feverish, probably I have typhoid, or I have malaria, or something like that.
Yes.
Okay, so at this point, let's bring in
Benoit
Benoit into the conversation and find out what awareness campaigns are being. You mentioned a few earlier, but we want to know specifics. So what is being done to educate people and get them aware of how to prevent? Because at this point, prevention is the best option.
Yeah, again, it's all about hygiene, but it's also very much about stigma and trying to make sure that people don't hide when they fear that they have Ebola. As it's been mentioned, the fatality rate of Ebola is very high, and people know that. So a lot of people are scared that if they go in isolation, they would die. It's work of our to try to go and see these people and identify them, talk to the communities to try to convince them, if they fear that they are infected, to go and get to the isolation center. So that's why we do psychosocial support for also the families of those who have lost people from Ebola, again to reduce stigma after, so the family members can stay in the communities and not rejected. So that's the work that the volunteers are carrying out at the moment in Guinea.
Okay. And Krishnan, how is this outbreak? I want you to paint a picture for me. How is the outbreak affecting the daily lives of the average Ghanaian?
Yeah, I think to begin with, there is a lot of confusion over this, and that's one of the reasons why there is a lot of rumor spreading. People are really scared. So this is where getting clear scientific messages out in simple language is absolutely crucial at this stage. And some of the measures that are involved in preventing the spread is, as I stated earlier, is better sanitation and better hygiene practices. But also remember that touching people who have died from Ebola, especially during the funeral, is a source of infection. So this is where clear messages about prevention is very crucial. So if you talk to people, if you talk to children, they are really scared. And that level of fear comes from lack of credible information. And rumors only amplify such fear. So this is where, irrespective of the number of deaths involved and the spread and the scale of the disaster, it is important to step up the public health messaging to get a better grip on the spread.
Okay, so let's debunk the myth and get the right information out there so people know what exactly they're handling.
Okay, thank you very much, Dr. Krishnan. Okay, so we've heard so much information and, you know, awareness on how to keep ourselves guard up, but we have something very graphical, you know, on what to do and measures to take just to prevent yourself from being a victim of the Ebola virus. If we can have it on the screen, we have a picture that summarizes all the preventive measures to take. There's actually 6 in number. And the very first one,
Obviously,
you know,
don't eat bats.
okay, yeah, don't eat bats. Yeah, so you have to watch what you eat. You need to wear gloves, you know, because contact is one of the means of contracting this virus. So you have to be very careful. For those of you who go out to do your groceries, who go out for fruit shopping, or even for farmers who rear animals and you need to have, you know, wash your animals and stuff like that, don't do that without wearing a glove. And of course, you have to be careful. Body fluids for health workers who are treating patients who are infected, they need to take proper clinical and medical precautions. You know, they need to follow this very strictly and safely. So, yeah, that's basically that's it.
Okay, right now let's go on another break, and when we come back, we keep talking about Ebola virus and we'll tell you even more that you thought you knew, but you probably didn't know. Stay tuned.